Mesothelioma. Surgery. For early-stage mesothelioma near the chest wall or diaphragm, surgery may be performed to remove the cancerous tissue. The most common surgery is called extrapleural pneumonectomy, which removes one whole lung, the lining of the lung, the diaphragm, and parts of the linings surrounding the heart and chest cavity. For some patients, a pleurectomy, decortication may be done, which is a surgery to remove parts of the linings of the lung and chest cavity but not a whole lung. Surgery aims to prolong survival but does not cure the cancer, as cells often spread too much by the time of diagnosis. Radiation therapy. Radiation therapy uses high-powered X-rays or other particles to kill cancer cells and shrink tumors. For mesothelioma, radiation therapy may be given after surgery to kill any remaining cancer cells and reduce the risk of recurrence. It can also be used along with chemotherapy for palliative care to relieve pain and other symptoms from advanced stages of the disease. Common types of radiation therapy used include external beam radiation therapy, which aims radiation from a machine at the body, and intraoperative radiation therapy, which delivers radiation directly to the tumor bed during surgery. Chemotherapy. Chemotherapy uses anti-cancer drugs to destroy cancerous cells. It is a primary treatment option for mesothelioma when surgery is not possible due to advanced disease. Combination chemotherapy typically used includes a platinum-based doublet of cisplatin or carboplatin with pemetrexed, Alimta. Clinical trials have found this combination can improve survival compared to cisplatin alone. Chemotherapy is often given systemically through intravenous administration to reach cancer cells throughout the body. It aims to destroy cells that have already spread from the primary tumor site. Targeted therapy. Targeted therapy uses drugs that disrupt the growth and spread of cancer by interfering with specific molecules, molecular targets, involved in tumor growth and progression. For mesothelioma, the anti-angiogenic drug bevacizumab, Avastin, when added to chemotherapy, was found to improve progression-free survival and response rates based on clinical trial results. Other targeted therapies in clinical trials include inhibitors of growth factors and immune checkpoint modulators. Targeted therapy aims to shut down the blood vessel formation and specific cell signaling pathways that cancers use to grow and metastasize. Immunotherapy. Immunotherapy for mesothelioma refers to treatments that help the body's immune system fight cancer. These include vaccines to stimulate anti-tumor immune response, immune checkpoint inhibitors that help immune cells attack cancers, and adoptive cell therapy using T cells genetically engineered to attack tumors. Currently, the immunotherapy drugs approved by the FDA for pleural mesothelioma include immune checkpoint inhibitors nivolumab, Opdivo, and pembrolizumab, Keytruda, based on clinical trial data showing improved overall survival compared to chemotherapy alone. Immunotherapy aims to unleash the immune system so it can better recognize and destroy cancer cells throughout the body. Palliative care. When mesothelioma advances and can no longer be treated curatively, palliative care aims to reduce symptoms, improve quality of life, and make a patient as comfortable as possible. Procedures like pleurodesis or shunt placement may help drain fluid buildup. Radiation therapy can help relieve pain. Medications assist with pain, shortness of breath, chemotherapy side effects, and other complications. Nutritional and psychological support also forms a significant part of palliative care. The goal shifts from treatment to prolonging life with dignity and minimizing suffering at this stage. The treatment options selected depend on the tumor location, stage, patient overall health, preferences, and other clinical factors. A multidisciplinary care team is important to receive the most appropriate and personalized management approach for each mesothelioma case. While curing mesothelioma remains challenging, trimodality treatment combining surgery, chemotherapy, and radiation offers the best possible outcome. Even in late-stage cases, available therapies now help patients live longer and with a better quality of life compared to several years ago. Ongoing research continues improving mesothelioma treatments and outcomes. Ovarian cancer. Surgery. Surgery is a mainstay of ovarian cancer treatment and typically involves removing one or both ovaries and fallopian tubes. salpingo-oophorectomy, the uterus, hysterectomy, and staging biopsies of the pelvic and abdominal regions. In advanced stages, when cancer spreads beyond ovaries, debulking surgery aims to remove as much of visible tumor tissue as possible to less than 1 centimeter in size. The goal of surgery is diagnostic to determine stage and curative with intent to remove all cancerous tissue when possible. Chemotherapy. Most women with ovarian cancer undergo chemotherapy after initial surgery. Platinum-based chemotherapy, for example carboplatin, cisplatin, combined with taxanes such as paclitaxel, is often first-line standard treatment. The combination of carboplatin and paclitaxel followed by additional chemotherapy is the current standard of care for advanced stage disease following initial surgery based on research showing improved survival rates. Chemotherapy can be given intravenously after surgery or additionally into the abdominal cavity, intraperitoneal, for optimal cancer cell coverage and exposure. Radiation therapy. Radiation therapy may be used in some cases as adjuvant therapy after surgery and chemotherapy to destroy any remaining cancer cells and reduce the risk of recurrence. For select patients with later-stage cancer, radiation therapy can also be used for palliation to relieve cancer symptoms. External beam radiation aims radiation from outside the body, and internal radiation, brachytherapy, places radioactive materials directly inside the body. Targeted therapy. Targeted therapies approved for ovarian cancer treatment include bevacizumab, Avastin, which inhibits new blood vessel formation that tumors require, and PARP inhibitors like olaparib, Lynparza, for those with BRCA gene mutations increasing DNA repair vulnerabilities. These treatments are commonly used beyond first relapse when combined with chemotherapy based on improved outcomes shown in clinical trials. Maintenance therapy. Some patients receive maintenance therapy with bevacizumab, olaparib or other agents for an extended period after initial chemotherapy response to delay relapse. This has been shown to significantly prolong progression-free survival and is an option for selected patients based on tumor biomarkers and tolerability. There are also immunotherapy clinical trials investigating using treatments that boost the immune system response against ovarian cancer, though most are still in investigational stages. Combination treatment using different modalities continues improving overall survival rates and outcomes for women with this disease. An important part of management is close surveillance long-term to monitor for recurrence and enable early intervention when needed. Ongoing research also works to discover new treatment options, providing more targeted, effective and less toxic options in the future.